Everybody for joining us this morning for the first full committee hearing of the 113th Congress, honoring the commitment, overcoming barriers to quality mental health care for veterans. It's only fitting that we would start with this hearing today as we begin our oversight by addressing what I think is one of the most pressing and fundamental issues facing our service members, veterans, and their families, and that's the ability to provide timely and effective mental health care to veterans who need it, when they need it. This issue is not a new one, but I think everybody will agree that it is a growing issue. In the last 6 years, there has been a 39% increase in VA's mental health care budget and a 41% increase in VA's mental health care staff. Unfortunately, these significant increases have not resulted in equally significant performance and outcomes. Now, less than a year ago, the VA Inspector General released a review of veterans' mental health care access that painted a disturbing picture, showing that the majority of veterans who seek mental health care through VA wait 50 days on average for an evaluation. That figure amounts to thousands of veterans in need, veterans who have recognized that they need help and who have taken the hard step of asking for that help, being told by a Federal bureaucracy tasked with caring for them that they can wait in line because the VA cannot provide them with timely access to the care that they need to begin their healing process. And it only gets worse. Earlier this month, VA released its 2012 Suicide Data Report. The report shows, among many alarming findings, that the suicide rate among our veterans has remained steady for the past 12 years, with 18 to 22 veteran deaths per day since 1999. As that report so clearly illustrates, when a veteran is in need of care, the difference of a day or a week or a month can be the difference between life and death. This morning, the Department is going to testify that progress is being made to increase access to mental health care services and reduce veteran suicide. I think they are going to proclaim that they have hired just over 3,200 additional mental health care personnel. However, despite our request, VA has yet to provide evidence to verify its efforts. While I am and will remain supportive of the improvements that the Department is attempting to make, it has become painfully clear to me that VA is focused more on process and not on its outcomes. The true measure of success with respect to mental health care is not how many people have been hired, but how many people have been helped. Since 1999, their mental health care programs, their budget and staff have increased exponentially, and the number of veterans seeking care has grown, yet the number of veterans tragically taking their own lives is still the same. What's more, the Suicide Data Report that I mentioned earlier shows that the demographic characteristics of veterans who die by suicide is similar among those veterans who access VA and those veterans who don't access the VA system. Something somewhere is clearly missing. Now, on our first panel this morning, we will hear from representatives from our veteran service organizations, an established veterans mental health researcher, and a State Commissioner of Veterans Affairs. 3 of them are veterans themselves, and all of them will testify that the provisions of mental health care services through VA is seriously challenged, and that what is needed to fix is decidedly not more of the very same thing. Last night, the President announced that a year from now, 34,000 of our service members currently serving in Afghanistan are going to be back home. The one-size-fits-all path that the Department is on leaves our returning veterans with no assurance that current issues will abate and fails to recognize that adequately addressing the mental health needs of our veterans is a task that VA cannot handle by themselves. In order to be effective, VA must embrace an integrated care delivery model that does not wait for veterans to come to them, but instead meets them where the veteran is. VA must stand ready to treat our veterans where and how our veterans want to be treated, not just where and how VA wants to treat them. I can tell you this morning that our veterans are in towns and cities and communities all across this great land, and the care that they want is care that recognizes and respects their own unique circumstances, their preferences, and their hopes. I earnestly appreciate all of you being here today, and I yield to our ranking member, Mr. Michaud, for his opening statement.
Thank you very much, Mr. Chairman.